My name is Grace Salako. My presentation is on building a healthcare workforce for the Future Act. Historical context. This legislation was introduced in the Senate on September 30th, 2015, and was sponsored by Senator Jack Reed. It was introduced and read twice in the Senate, and was then referred to the Committee on Health, Education, Labor, and Pensions. The purpose of the bill is to amend the Public Health Service Act to help build a stronger healthcare workforce. It also requires the Department of Health and Human Services to award matching grants and enables states to implement scholarship programs to ensure an adequate supply of health professionals. Let me talk about the Public Health Service Act. It is a United States federal law enacted in 1944. It was signed into law by President Roosevelt on the 3rd of July 1944. The Act brings together all existing law affecting the service. It eliminates many outdated regulations and authorizes expansion of the federal state cooperative public health programs. The final act was 2 years work and study under the leadership of Representative Alfred Bullwinkle of North Carolina. Financial. Department of Health and Human Services may award grants to assist medical schools in developing and strengthening primary care mentorship programs and cultivate leaders in primary care among its students. Authorization of appropriations. Up to $20 million to be appropriated for each of the fiscal years from 2016 to 2020. Not less than 50% of the amount appropriated for a fiscal year shall be used to provide scholarships to providers who intend to pursue careers in primary care. Eligibility. To be able to receive a grant, entity shall be an accredited medical school or college of osteopathic medicine and submit an application to the Secretary. The students are to provide resources for aspiring mentors to participate in workshops or other learning experiences. In this, primary care physicians can learn about effective strategies in primary care mentoring, enable successful primary care mentors on medical school faculty to spend time at another institution. There, they can promote best practices in mentoring primary care leaders and students and develop web-based resources for mentors to interact regularly and share successful strategies. They can also cultivate leaders in primary care among students, including this category of students should have developed longitudinal experiences in primary care and track the health and wellness of patients throughout medical school. Stipends or other forms of financial resources will also be provided to students who work with designated mentors in the field of primary care. This also includes other efforts in which primary care physicians are taking a leadership role in the delivery system reform. Quality of care and of life. Grants are to be awarded to medical and other health professional schools to promote priority competencies. This will enable the fostering of curricular innovations to improve the education and training of healthcare providers and bring about production of well-rounded healthcare providers. Grants to develop and promote new competencies. In order to foster curricular innovations to improve the education and training of healthcare providers, the Secretary shall award grants to medical and other health professions schools to promote priority competencies. Such annual competencies may include patient-centered medical homes, chronic disease management, integration of primary care and mental health care, integration of primary care, public and population health, and health promotion, cultural competency, domestic violence, improving care in medically underserved areas, and team-based care. Ethical and legal issues of the legislation. The Department of Health and Human Services must seek to enter into a contract whereby the National Academy of Medicine, formerly known as the Institute of Medicine, studies the documentation requirements for cognitive services required under Medicare and Medicaid and through private health insurance. Consideration in evaluating grant applications. The Secretary shall give consideration to applicants that are proposing to partner with other medical programs. Grantee reports. The recipient of a grant shall submit to the advisory committee a report. This should be a description of how the funding under the grant was used by the grantee, the intended goal, the challenges faced by the grantee, and the lessons learned by the grantee related to the grant activities. Recommendations of the Advisory Committee. The Advisory Committee shall annually report to the Secretary on outcomes of the activities carried out under the grants. Authorization of appropriations. $10 million has been appropriated for each of the fiscal years from 2016 to 2020 to carry out this section. If this legislation is passed into law, education reforms, shortages of providers, changes in healthcare financing, role of new technologies, and the need to revamp regulations would have been adequately addressed. Thank you.